Hello, I'm Dr. Vance Thompson, and welcome to our Refractive and Cataract Surgery 2025 seminar. These are my partners, and we practice in 9 locations across the upper Midwest. And no matter which location you're visiting, here, Sioux Falls, we want you to be educated on your options so that your consultation can be the best it can be as you're thinking about your lifelong vision decision. It helps to understand how the eye works, and the cornea is the front window of the eye, and it actually has the tear film over the top of it that provides the majority of the focus power of the eye. A lot of patients don't understand how important that tear film is for focusing light real crisp. And in your consultation, we actually do a good analysis of your tear film to see if there's any source of tear film blur, since dry eyes are so common. And we want to make sure that all sources of blur are taken well care of. And then we have the lens behind the pupil that provides variable focus power in our younger years, helps us see distance and near. We're going to talk a little bit more about that. And then we have the retina in the back of the eye, where if the image is focused nice and crisp, we typically have nice crisp vision without glasses. And then you see the little optic nerve that takes vision to the brain so the brain can tell us what we're seeing. Now, if everything's working perfectly, that front window, that cornea, will provide about 75% of the focus power of the eye, and the lens about 25%. And together, you get a nice sharp focus point on the retina. Now, it's important to remember that the tear film, again, is the majority of the focusing power of the eye, right where the air meets the tear film. We call it the air-tear interface. So again, whatever you're seeing us for, we're going to be evaluating your tear film to make sure it's functioning real well and giving you the best possible image quality. Um, Remember that lens provides zoom, and that zoom is what we lose in our 40s, but actually can be restored, and you're going to learn about that in this presentation. Now, refractive error happens when the image isn't focused on the retina, and then the patient is blurry without glasses or contact lenses. Now, nearsightedness is very common, and that happens when that front window, the cornea, is either too curved or the eye is just physically too long, but the focal point is happening before the retina. So by the time it gets back to the retina, it's defocused and blurry. In farsightedness, it's just the opposite. These patients, the cornea and the lens do not function or focus strong enough. And so theoretically, the focal point would be behind the eye. Farsighted people see better at far. Nearsighted people without glasses see better at near. And then there's astigmatism that blurs all distances. We end up with two focal points. You'll oftentimes hear people say the cornea, that front window of the eye, is more football shaped. And if you think about the football, like in this case, from 12 o'clock to 6 o'clock, it's more curved. And so it focuses light more, and you can see the red focal point happening well before the retina. Whereas from 9 o'clock to 3 o'clock, the kind of ends of the football are the long portion of the football is focusing light less strong, and the focal point's actually getting closer to the retina. And so the patient has two major focal points, and that creates blur at all distances. But we can correct that with glasses, contacts, or surgery. These different types of refractive error, nearsightedness, farsightedness, and astigmatism, are what glasses and contact lenses correct. And, sometimes, though, that image just isn't as clear as a person would like. So if we take a closer look, a little bit of an optical lesson here. But nearsightedness, farsightedness, and astigmatism, we call them low order aberrations in our fancy words. And typically they're making up the majority of the source of your blur. But there's also these things called high order aberrations that create irregularities in our optical system. These high order aberrations create nighttime glare, oftentimes, and we can measure those in your evaluation. So something to keep in mind if you're experiencing some nighttime issues, we can measure that and find the source. Now, besides low order and high order aberrations, we also have this presbyopia issue, which is basically after the age of 40, we need readers or bifocals. The Greek derivation of presbyopia is presby, old, opia, vision. And there are great treatments for it. So we like to talk about the reading lens behind your pupil as being nice and flexible in our younger years to help us see up close, it gets fatter, and to help us see at a distance, it gets more flat. What happens after the age of 40, though, it gets kind of stuck at a distance, it loses its flexibility, and people start to need reading glasses, or they need reading glasses in their glasses, which is bifocals. This happens to everybody. And we're going to learn a little bit more about this. Now, we know that glasses and contact lenses work great, but we also see patients who are interested in learning their surgical options for correcting their vision. We think of refractive surgery as surgery that changes the way the eye focuses light on the retina. And that surgery, it basically can take that focal point that's not happening on the retina and change it so it's happening on the retina. And it's basically permanently can do that. And let's learn about some of these options. Now, we've learned about the cornea and the lens. When we think about laser or implant vision correction choices, we can laser the cornea, which is LASIK, one of the more common corrections. We can put an implant right behind the pupil. The EVO ICL is the most common one we use. I think of it kind of like an inside the eye contact lens. And then we can also replace the natural lens, and we can do it when a patient has just needed reading glasses, or we can do it after that lens has not only gotten stiff, but it's also gotten cloudy, what we call a cataract. And we'll be learning a little bit more about that and some of these decisions about, reshaping the cornea with laser, placing an implant, or replacing your natural lens that isn't doing everything that it used to do. In your consultation is where you really learn your options, non-surgical and surgical, and what's best for your eyes. And then we can use our experience combined with, the knowledge of what we've learned about you to help give you a recommendation, what we would do if we were in your shoes. And I think that's a good way for you to go home and kind of daydream accurately and do some research about what your best options are. Now, questions that help us help you. One of the most important is how are you seeing with your glasses or contact lenses now? And what's your hopes and dreams for your vision? And someone in their 20s, 30s, and early 40s, oftentimes they're saying, I see great with my glasses and contacts. I just want to see great without them. They're seeing great at all distances. And lots of times, because their natural lens is functioning so well, those are patients who we can do procedures like LASIK and make a thin flap that, is about the size and thickness of a contact lens. And we can take a colored map that we've learned everything about your eye and take even some of the irregularities and even those out. And then once the laser has taken care of that, we can replace that flap. One of the most successful surgeries known to mankind. Now, we also, especially for moderate to higher corrections, we can put in an implant. It's like an inside the eye contact lens that fits right between your pupil and your natural lens. And what's nice about that is it maintains that focusing ability of your natural lens. As far as which procedure, well, in your consultation, we're looking at your level of correction, the prescription in your glasses or contacts, the thickness of your cornea, your tear film health, and other measurements that help you make that decision. Now, once people are getting into their 40s, 50s, and early 60s and older, they're needing reading glasses and bifocals. And a lot of people we see want to see great without them. Now, the main problem is their natural lens behind their pupil just isn't reading anymore, especially those patients in their 40s and 50s and early 60s. And you can actually replace the natural lens with a new lens implant and restore that reading range. A lot of patients in their 40s, 50s, and 60s have seen cataract patients that are in their 70s and 80s that now have the reading range of someone in their 30s because of advanced implant technology. And, and some of the younger patients don't want to wait for cataracts. They want to use an implant now to restore their reading range. We call that procedure refractive lens exchange. It's basically lens replacement, just like cataract surgery. Now, if we look at that lens right behind someone's pupil, in the upper left-hand corner, you can see it's relatively clear. In the lower right-hand photo, you can see it's become cloudy. That's a cataract. And that happens slowly over the years. At what point in time it goes from the normal cloudiness of aging to what we would call cataract really has a lot to do with your nighttime image quality. If it's a nice crisp image at night and you're driving in that construction zone and it's raining and dark and there's cars coming and it's still nice and crisp, well, your natural lens is probably quite clear. But if you're finding that your low light image quality in those situations just isn't as crisp as it used to be, it's probably your natural lens starting to get fuzzy. And that's when we start thinking about lens replacement. Those are the patients who wear glasses or contacts. They're just not seeing that well without them, with them anymore. And then the patients who don't need, you know, correction for distance and they have just needed now readers in their 50s or 60s, they might be noticing their evening and low light image quality getting fuzzy, and that would be their natural lens oftentimes getting hazy. Those patients, we oftentimes can take that lens that is getting cloudy and is on its way to becoming a cataract, and we can replace it and make things clear again with a new lens implant. Now, that new lens implant has a big question because there's multiple types of lens implants. Does the patient want an implant where they need bifocals afterwards, or do they want an implant where they don't need glasses? And these new lens implant decisions are very important. A standard implant, the one that insurance typically covers, will replace the clarity, but not the reading range. So the patient would wear bifocals typically after a standard implant cataract surgery. An advanced implant that it brings with it technology that restores both clarity and reading range is something that's really grown in popularity. Insurance still just covers the price of a standard implant. And so there is an extra investment for advanced implant technology, but we've also seen great patient satisfaction for the right candidates. And so we do a lot of standard and a lot of advanced implants. And in the consultation, patients who are having troubles with reading glasses or bifocals or nighttime image quality want to learn about both standard and advanced implants. So you can see there's a lot of options in laser in implant vision correction. We can, work on the cornea with things like laser vision correction, LASIK. We can place an inside the eye lens implant, the EVO ICL being the most common one made by a company called Star. And then we also can do lens replacement, where we're either doing it just for patients that need reading glasses and want to get back that reading range in their 30s, or patients who are also experiencing fuzzy nighttime vision and loss of reading range and want to replace that lens with something that gives them the reading range for their younger years. In the consultation, you'll learn about all of these things. I hope this presentation on refractive and cataract surgery options has helped you. And again, no matter which of our centers you're going to, coming in for the consultation is the best way for us to learn about your hopes and dreams, your eyes, and to give you a recommendation that helps you with your lifetime vision decision. Thank you very much.